Let's talk about that physiology that's happening in the background where people can go for years, their insulin's out of control, destroying their body, and they don't even realize it.
There's not enough screening for insulin resistance in general population, and that's because again we practice medicine in a reactionary way, in a not a proactive way, right? Um, when people gain weight and you start seeing some problems, their cholesterol or their waist circumference and their blood pressure, etc. Even before that, we need to educate people, even in the college, even in the high schools, that what would happen if you gain weight. Gaining weight, most people think it's just a cosmetic problem. It's not. What happens when you fill those fat cells? What kind of nasty inflammation comes out of it? Why you're so fatigued? Why you're so tired? Why would that happen to begin with? It will prime people much better to prevent from gaining weight and maintaining a healthy lifestyle rather than waiting something disastrous to happen to take action. In our health system, we like to put codes, right? Diagnostic codes. When you put, like, they didn't even recognize obesity as a disease until recently. Insulin resistance was not a disease. They didn't accept that because there was no drastic consequences, like immediate consequences. Like, it's not like a heart attack, you have to go get a stent. So as a result, it goes under the radar for a long time unless somebody points out, hey, I see this and you got to do something right now. And the problem is, again, human nature. Let's say you're a financial advisor, you tell people, hey, you put your money into this mutual fund or whatever in the stocks, and it's going to grow in 20 years, or your retirement account, you will do well. What do people do? 20 years, way too far, right? So that's human nature. People want immediate rewards. So with the health, we tell people, hey, if you gain weight, this is what would happen. You develop diabetes. But people think that, it wouldn't happen to me unless they are really scared from their family members, like diabetes in their family and stuff like that. Um, but it requires repetition, constant education, and maybe education at an early stage, like really young stage. I think it should be in the curriculum in every high school and college and stuff like that, that consequences of weight gain and insulin resistance to anybody. Um, if for astute clinicians, they will check insulin levels, glucose, they're going to calculate HOMA score. People like to see things more materialized instead of getting some sort of haphazard advice from a doctor, right? Because when you say, hey, look, you have this, and it attracts their attention. Um, so clinicians can do that to get people on board with their treatment plan in terms of their diet and exercise, suggesting that you have signs of early problems. Same thing for kidney disease, heart disease. It should all be done. But what ends up happening is we catch them so late that, oh, well, I think you should go get a stress test done. And maybe next thing you go get a stent placed. But if you told them that insulin resistance would have caused that 10 years before, that would have never happened.
And when it comes to testing and realizing there's a problem with insulin early on, is a fasting insulin test the only objective way to really know what's going on there?
So actually, the insulin levels go with the glucose levels. It has to be, in correlation. Fasting can help, but actually, yes, if you are spiking insulin after your meals, and let's say your blood sugar is 90, your insulin level is 10, that's fairly acceptable. But if you eat food and your blood sugar goes to 150, your insulin spikes to 80, 90, now you tend to think that, okay, well, your insulin is spiking way more than it should compared to your glucose. So that when some clinicians don't get that, and that is the problem, because if somebody's glucose is 90, their insulin will be low. Why would their insulin be high? Um, but if you check glucose and insulin haphazardly after a meal, whatever, and you look at the glucose and in that, and then look at the insulin at the same time, then you can say how high the insulin is really going compared to glucose. Because like normally you shouldn't go over 120 in a perfectly healthy pancreas. But if your insulin is going so high, it's like Your car is revving the engine to be able to go over a bump. You'll be like, what's wrong with my car, right? So the same thing in the body. If your insulin goes so high to maintain your blood sugar, you have a problem. To your point, yes, insulin at a fasting state can be an indicator, but it's not the only indicator.
So when you're working with patients, what kind of lab work will you do when it comes to insulin? Are you testing just after meals then with the blood glucose, or what does that look like?
So I typically test it at fasting state, and that gives us a good HOMA score. But if they have fairly good insulin and good glucose levels, that maybe they're, because what happens in the diabetes and insulin resistance world, the first defect actually starts happening, the insulin production defect starts happening also postprandially after a meal. So if we think everything looks fine on the fasting, then we go for the next stage. You can do a mixed meal test, have them eat a mixed meal with protein, carbs, and fat, and then check their insulin and glucose, and then look at that. And interpretation of that test is not universal. It is somewhat subjective, but it is, I think if you have enough experience with it, you'll be able to understand what's going on.
Is there any other blood work or testing you like to do with your patients?
So actually, Quest and LabCorp, they offer insulin resistance scores, for example. So they look at their triglycerides, their LDL, their HDL volume, their HDL particle size, LDL particle size. Um, when you're insulin resistant, you will have higher number of small LDLs and a small number of large LDLs. So your HDLs will be tiny, your LDLs will be tiny as well, and that can tell you about insulin resistance as well. However, the problem with that approach is it's not paid by the insurance companies most of the time. So I always disclose patients, hey, we can order these tests, but I want to make you aware that you may get a bill about this. But most of the time, you don't have to run a lot of tests to know somebody's insulin resistant, right? So it's mostly clinical. You can tell. Look, if somebody has a skin tag on their body, they have already acanthosis nigricans on their skin. They have abdominal circumference. Their skin is not right. You can tell their skin is rough, dry. There's so many clinical clues that you can pick as a clinician to say, oh, their eyes don't look right. They're saggy and ballooned so you can see that they're inflamed and there's edema in their body. What's the point of running a test? You already know that, right? So you already know. Now, sometimes I do the test to convince them, yes, you do. If I tell them, hey, you have insulin, they'll say, based on what, right? Because we trained patients as doctors to keep testing, right? We have to run an MRI to diagnose something. We have to, the physical examination and talking to the patient is gone. Those days are gone. So doctors just want to order tests and tests and tests. And now patients think that they have to get a test to get a diagnosis. But if you're a good clinician, you can just look at your patient. And they used to teach us in medical school, the moment the patient walks into your office or you walk in, the first observation, that's 50% of your diagnosis. You can tell by looking at like acromegaly patients, right? From their facial features. I had some endocrinologist, my mentor one time. He told me he diagnosed people in the grocery stores, which is a very rare disease, by the way, like 1 in a million kind of thing. But he's paying attention. He says, maybe you should get checked, for acromegaly because your teeth doesn't look right, your nose doesn't look right. So but as a personally, when I look around, yeah, I tell people like this is insulin resistant, that's insulin resistant because I know what I'm looking at. So the bottom line is they have a lot of features, signs, and symptoms that you can tell that they're insulin resistant, but there are tests to prove the point.
Given the fact we've talked about how insulin resistance can often, be occurring behind the scenes for years before somebody finds out, given the work you do in diabetes and working with people and their insulin levels, I'm just curious, how many people do you feel have insulin resistance and they're going around day to day feeling like they're healthy, but they have no idea that underneath it all, their insulin's all over the place?
Right. So I would say that's probably 60% of the population.
Wow.
Because we have 70-80% of the population in the US is overweight. And I would say at least 50-60% of people are insulin resistant without knowing it.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
It's never too late, but the earlier you start, instead of postponing, the better to reverse diabetes.